Go ahead.
So you're still having chest pain when
I
you're
am.
on the treadmill?
Right.
Well, we have a decision to make today about how to treat your chest pain, and I'd like to use this decision aid to help out. So we can use medicines alone or medicines plus a stent, and as we talked about, this is just for stable angina, like your symptoms. Now let's talk about the benefits of adding a stent. It actually will not reduce your risk of having a heart attack or dying.
Really?
Yep.
I didn't know that.
So the benefits are primarily in making you feel better faster. So of 100 people like you who have chest pain like yours, 47 will feel better with medicines alone. But there's an added benefit for a stent. 10 out of 100 will feel better because of that stent. And those in gray won't feel better with either therapy. Over time, up to a year, those with medicines feel better, and there's very little difference between stent and medical therapy. So based on that information, what decision might you choose?
Well, I'm very active, or I was very active, so I would like to resume that activity as soon as possible. So I'd like to explore the stent.
Okay. Well, let's talk a little bit about the risks associated with the procedure,
Okay.
and they are rare. So during the stenting procedure, 2 out of 100 can have bleeding, and 1 out of 100 has the risk of a major complication like a heart attack, stroke, or death. In the year after your stent, you'll need to take a blood thinner, and there is a risk associated with that of bleeding. 3 out of 100 will have major bleeding, and 2 out of 100 can develop a clot within the stent that can lead to a heart attack. So there are some risks associated, albeit not uncommon. Now, in the year after this decision, if you chose medicines, 14 would actually go on to need a stent. If you do choose a stent today, there's still a chance 7 out of 100 would need to have another procedure. So based on those benefits and risks, what do you think might be the best choice for you?
I think a stent would help me feel better faster, and the risks seem to be pretty low.
Okay, well that's reasonable, so we'll
Okay.
go forward with that option.
Okay, sounds good.